HealthVisions Midwest hosted the conversation Every Mother, Every Baby, the crisis of maternal and infant mortality. Deja Bailey of HealthVisions Midwest of Hammond and Cassius Stallings of HealthVisions Midwest of Fort Wayne were joined by Riley Children's Health Dr. Lauren Dungy-Poythress and Indiana University School of Medicine Dr. JoAnn Matory. Dear Heavenly Father, we come to you, Lord, and we just thank you. We thank you for today. We thank you for this moment. We thank you for this opportunity that my coworker and I have to just be up here and talk to experts around a crucial issue. And we're just asked that you open up the hearts, the minds, and the ears to everyone that is listening. Allow this space to be grand. Allow it to just all the answers and everything that we need from this conversation to come out in the flow. It's in Jesus' name that we pray these things. Thank you, God. Amen.
Amen. Thank you so much, Cassius. So yes, everyone, hi, my name is Deja Bailey. I'm the outreach coordinator at HealthVisions Midwest in Lake County, Indiana. Today we are joined by Dr. Dungy-Poythress and Dr. Matory, and we thank you so much for being here. We are so blessed to have this conversation today in present day where things are being kind of, put on mute, taken away. So we are blessed to have this conversation during National Black Mothers Maternal Health Week, especially. So thank you so much. And kind of just going based off of that, what are your thoughts on Black maternal health? And I just kind of want to open up with the opening question of how does racial bias in the healthcare system impact Black maternal health outcomes? I know that's kind of a broad and heavy question, but how to kind of preface this conversation?
Certainly, if you look at health outcomes for mothers, that there is a great disparity, that there's worse outcomes for Black mothers than there are for white mothers. And I use Black mothers because there's something about the color of the skin, whether you're in Germany, whether you're here in the United States, whether you're in foreign countries, the Black maternal mortality rate is always worse than the white. It's significantly worse here than in most other countries, and that has to do with structural racism and the biases that are afforded to Black people.
Absolutely. Absolutely.
And of course, Dr. Dungy-Poythress is speaking to the maternal side. She's maternal fetal medicine. I'm a neonatologist working with newborns. Anything that happens to mom when she's pregnant can impact the baby, the fetus, and ultimately then that newborn. And so issues that mom, and I know we're going to talk about lots of those issues and the factors that, and the risk factors that result in maternal morbidity, mortality, will then impact oftentimes the fetus and the infant too. So it works together.
Absolutely, absolutely. So based on the CDC and National Institutes of Health, they state that Black mothers are 3 to 4 times more likely to have childbearing implications or health determinants that are based because of their being Black. So how would you kind of...
If you look at anything, if you look at the rates of people dying from COVID, if you looked at health cancers and other things, Black people always do worse than white people. And it's always somewhere between 2 and 4 times worse. And that has to do with a lot of factors, but there's something inherent to, and again, it's across the world. It's not just here in the United States. So there's something inherent to the color of the skin. And there's nothing biologically different about a Black person versus a white person. But so you have to look at those structural things that and social things that impose those discordances on Black women in the case of maternal health. Did that answer your question?
It did.
Deja, we can hear you online. The online is perfectly fine, but just a little bit more rejection so that back in person here.
Okay.
Thank you.
Appreciate that. Thank you. So how would you say, what kind of trainings could healthcare professionals go through in order to combat like the implicit biases? What kind of trainings did you guys all go through in order to become a medical professional?
I will say that so I give lectures lectures on implicit bias in healthcare.
Yes.
And we talk about implicit bias training and cultural sensitivity training. If we just read the Bible and said we should treat people the way we want to be treated, I think that's a good lesson. We have things where I'm sure Dr. Matory and I could say, they said, what training did you go through? We went through life to understand what it means to be a Black woman in this society and a Black woman in, what traditionally it's been a white male dominated field, but
Right.
there are things that we all go through in life. There's sensitivities we need to have to whatever it might be. Riding a bus. How many people in medical school actually had to ride a bus anywhere compared to those people who do? So there's things we need to be sensitive to regardless of the color of our skin. But we do have implicit bias training, and I give these lectures and I say, it should be like the 2-minute drill in football. You can't do it just once and say, I got that. When it comes down to the 2 minutes left and I want to win this game, we don't say, yeah, remember that drill we did a year ago? Just do that. We got to practice it and do it every chance we get if we want to be well at it. And so oftentimes we fall short in those efforts to be more culturally sensitive.
Absolutely.
Yeah. And I'll be honest, in terms of my training and medical school residency and the like, I did not have any specific courses that spoke to implicit biases and, discrimination. I will just have to say, I trained a lot of years ago. And so that has been identified now. The DEI initiatives have been identified. They are important, and more work is being done. Lectures like Dr. Dungy-Poythress provides and others that help increase the awareness, because if we don't talk about it, then it becomes something that, it's kind of whispered and, nobody's worried, and we will ignore that. And then it's not addressed as an issue, which we all know is an issue. It is a concern. And we need to, confront it and have those conversations with our colleagues, trainees, when I work with the residents and medical students, family, our church, wherever we can get the message out, to think about what it feels like to be discriminated against, what it feels like to be ignored, what it feels like to recognize that the people on that side of the room get some advantages that the people on the other side of the room don't get, just because of the color of their skin. And so, as Dr. Dungy-Poythress indicates, we can tell you stories about situations. I've been told that, I kind of have a target on my back just because I am a Black female who is, involved in some leadership and some programming, but I'm Black. And so that doesn't necessarily work in my favor, but I love it. I am Black, and I engage, I take it on,
Absolutely.
And my hope is that I can then spread that word to the generations that are coming up after me, and the children. So once again, pediatrician, neonatologist, whatever I can do, whatever we can do to help our children, prepare better and move forward. I don't want to take over the whole conversation, but I really feel passionate about the fact that this is important work that we have to do for our children, for our people.
Absolutely. So what would you say for expecting mothers or birthing individuals that are having fear or apprehension about coming to seek care, medical care, and they don't want to go because they're afraid, they see everything that's going on, the DE initiatives being stripped away, DI initiatives being stripped away. What would you tell them to make them want to come and seek care that they need?
Well, that it's important, and that there are things that you don't let other people's opinions or other people's biases or other people's poor treatment hinder you. Do not cut off your nose to spite your face. If you need medical care, to give you an example, once I had a friend whose mom had a breast mass, went to her doctor. He said, you need a mammogram. And so she called to schedule the mammogram. The person was rude to the phone on her. She hung up the phone and said, I don't have to deal with that. And then she realized, oh, wait a minute, I'm only hurting myself. I do need this mammogram. She called back and she got an appointment. Turned out she had breast cancer. It was treated, and she had much better survival rate than if she ignored that and said, because they don't treat me well, I'm not going to go there. Now we're trying to, on our side, trying to make efforts where we can help train people to treat people better. But even if they're not, get the care that you need. And I encourage people to find a doctor that you like and that you respect and that you have a relationship with before you get sick. So don't just wait till you're sick to go to a doctor. Don't wait till you're pregnant to go find an OB/GYN doctor.
Right.
Find somebody you can build a relationship with and have a good rapport with before it becomes critical in those situations. And you can do better in that regard. But don't, I've been places, we've been places where, they act a little, rude to you. And it may not just be people who are not the same color as you,
Right.
but don't cut off your nose to spite your face if you need the care and early access. And I will add that, when you look at, we always talk about early access to care. And we know that women who access prenatal care earlier have better outcomes than those who have late access to care. But then I always tell people, why do you think they're not accessing care? Do Black women who historically come into care later, is it because they don't have access to it? There's nothing in their community. They don't like the way they're treated. Maybe they're marginalized. And when you look at some historical things, like back in 2017, NPR and Robert Wood Johnson did a study, and they found out that 31% of Black women felt like they were discriminated against in the healthcare field. And 21% said they avoided healthcare because of it. Well, there's a reason for that. And for us on the medical side to say, well, these Black women just need to get in here earlier and get some care, or to understand why they're not accessing care. It's not because they don't care about their babies and they don't care about their health necessarily. It's usually things that are on the medical side, but we've got to work on both sides to confront those issues.
Absolutely.
How important would you say early screening for conditions like hypertension or diabetes or any of these things play a factor into?
If you don't know, you can't feel like you have high blood pressure. You can't feel like you have diabetes unless it's really bad. And so you need to have your blood pressure checked and have your blood sugar checked. And the earlier we get people into prenatal care, if we want to start low dose aspirin, for example, to reduce your risk of developing preeclampsia later in life, we want to do that between 12 and 16 weeks of pregnancy to start it optimally to get the best outcomes. So if you're not even coming in till 24 weeks or something later, then we haven't captured the best opportunity to reduce the risk. And Dr. Matory can tell you the difference. What low dose aspirin does is push out when preeclampsia happens. So if it happens at 38 weeks, she can tell you the difference between a baby that needs to be born at 31 weeks because of preeclampsia versus 38 weeks or something like that. So it impacts the infant's outcome as well.
Most definitely, because when we look at infant mortality, there's a list of associated factors, risk factors to be concerned about. Top of the list is birth defects, congenital anomalies. Number 2, prematurity, low birth weight. And so what's being described is if that baby is born at 31 weeks, those are the preemies, those are the babies who go to the newborn intensive care unit. They sometimes don't breathe well. They have a myriad of problems, and they end up being in the hospital for quite a while. And I'll tell you, when babies come into the NICU at 31 weeks, we'll just use that number, and parents say, well, when will my baby be discharged? We end up telling them, think about your due date, because what we aim for is to ideally get the babies discharged by the time they would have been due. So once again, looking at full term versus prematurity just makes, such a difference. And sometimes, I know Dr. Dungy-Poythress will say this, sometimes moms have to be delivered early. Their health is being compromised. The baby needs to be delivered. And so we can't always avoid all prematurity, but oftentimes we can avoid a fair amount of it if people will come in and get the screenings and the testings, the medications, the monitoring that they need early on. And then it may seem like, and I'm sure you hear this, an inconvenience when they're told you're going to have to stay in the hospital, because we need to monitor. And Dr. Dungy-Poythress, that's her area. But the point is, we want babies that are closer to term than premature babies.
And I will also say, so maybe it's not just hypertension or diabetes that we're trying to manage early on and help reduce the risk of the complications of pregnancy, which also will help reduce the risk of your long-term effects 2 decades after you deliver. But maybe it's HIV, maybe it's syphilis, maybe it's an infection that can affect your baby that can be relatively easily treated and reduce the risk both for the maternal health as well as the long-term health of the baby, that we can prayerfully prevent a baby being born with congenital syphilis or HIV.
And so when we think about that and we realize the barriers that come with, how do we help a woman, to ensure that she's getting the adequate, care and pre-screenings that she needs? Is it advocacy? Is it relationship with the practitioner?
Oh, so yeah. Yes.
All the above.
Yes, okay.
It's advocacy. It's voting. It's way even before you get to the fact that, oh, male or female, I want the best healthcare I can get. I want the best representation that I can get. I want the best resources and opportunities that I can have. So even just voting to have people who are representing you and in your best interest and trying to do the best for you is important. But also, the better you are, the better you are. So the better you start out before you get pregnant, the better you'll be during pregnancy, and the better you will be after pregnancy. And that's all your healthcare: high blood pressure, diabetes, lupus, any condition that you might have. The better you start out with before you get pregnant, the less risk for maternal compromise, congenital birth defects, and infant complications that we have with those conditions.
And something that we haven't spoken to yet is support. So most definitely we want moms to come for their care. We want parents to bring their children in, to the pediatrician's office. But the support oftentimes at home, in the church, in the community can make such a difference. So for that mom who's hesitant because of a negative experience she had on the phone call, she called in to make an appointment and someone was rude, to then hang up and then talk to either her good friend, her mom, her cousin, someone at church, just someone that they know who says, yeah, but you need to go. And to have that support from someone that they trust. And again, this could be a family member, it could be a friend somewhere else, is important, because that might be the voice they need to hear that says, okay, what's important is that I take care of myself, just as you gave the example, versus being offended by the fact that someone was rude to me over the phone. So I think the support that we can provide, I think conversations like this are so important because we spread the word. And that's going to be, to me, the bottom line in all of this. And if you have had a good experience with a physician and you talk to your friend says, well, I don't ever want to go to a doctor again. And you can attest to the fact that, well, my doctor, that I had at XYZ clinic or office, whatever, was really good. I liked her, I liked him. Maybe you then can convince that person to give it another try.
I will also say, sometimes it's not even the doctor. You can't even get to the doctor because you got that person at the front desk who's stressed, who's, told they need to do all these things. A lot of times it's not about you. It's just about the stress that they're having, but they're rude and you're offended by them. You don't even get past the clerk to get to the back door to meet the doctor, who might be totally lovely and very attentive and caring, but you're offended by the person who is answering the phone or checks you in, or the nurse who is overworked and taking your blood pressure and asks you, did you take your medicine today? And no, I didn't, because I was rushing because I had to drop this child off at daycare and I had to get the bus or whatever, or even, get there in time and I forgot to take my medicine. Now my blood pressure's up. And they sort of look at you funny and you're like, I don't like coming here. I'm not coming back. Try not to take that personally. I always say love is not easily offended. We just try to keep on, don't be offended, keep on going, show them some love back and appreciation, and raise above it.
Now, Dr. Dungy-Poythress, you spoke to before how microaggressions appear. I think you stated in one of your previous calls or presentations that there's a professional doctor that in Georgia that put on their practice about the
No
bonnet, no
bonnets.
bonnets.
Yeah.
I refuse practice if you are wearing a bonnet. Can you speak to how that can kind of deter people and,
So in Columbus, Georgia, there was a sign on the waiting room window that says no bonnets, no service, or something to that effect. Well, who wears bonnets? I wear a bonnet. I wear a bonnet when I sleep. I don't wear it out. I don't like my daughters wearing a bonnet out, but some people do. And I don't refuse you service for that. And if that predisposes to a certain population of patients, because if you're knowledgeable about African American hair, that it's pulled out by cotton in pillowcases. And so if you want to protect your hair and help it grow, you wear a bonnet at night. The same thing with another example I had was a person with braids in their hair who would pat their head, who the nurses determined was psychologically
and we know that's a normal thing.
got us.
Yeah.
So because this woman, there's something wrong with her
Wow.
because she's patting her head.
Yeah.
And I'm like, are you?
Ridiculous.
Yeah. So there are things, and the more we can educate people on that, and just try to overcome that. So if it means I have to take my bonnet off to get the care that I need, because that's the only clinic around, then I'll take my bonnet off. But if I can do something to say, hey, why are you doing that? I don't like your hair color. I don't like that you don't wear your hair straight like I do. So I don't want, people who don't wear their hair straight, or who wear, tattoos, or I mean, it could be anything. If we just try to treat people the way we want to be treated, maybe we could get past all that.
Absolutely. So we know it truly takes a village, right?
Amen.
So how would you say, we spoke to about having practitioners on staff that, you work in collaboration with. So what are your thoughts on doula care? What is your experience with doulas?
Doula is great. Doula is great. I will say that. Anybody who can advocate for you. I've served as somebody who advocates for somebody in labor, somebody who understands it more than you do, understands the processes, and to have a doula is awesome. I will tell you, I had a bad experience with a doula who in trying to advocate for the patient, I had an example of a patient who left the hospital against medical advice, had risk factor that her baby could die, and was coming to clinic. And so people, in trying to not offend her appropriately, I guess, weren't giving her the best treatment. And so when I see patients, I want to know what they understand about it. So when I asked her, what do you understand about what we recommend and why? Her attitude was, well, you should know it's in the chart. I said, I want to know what you understand.
Right.
I will tell you, at the time I had laryngitis. So I sounded like this, and it sounded rough and harsh. And so, so then the mother stood up and said, I said, well, and she clearly didn't want to talk to me. I said, well, do you understand your baby could die? Because I need to know that. And the mother stood up, well, you're being rude. You're being rude. You're talking about babies dying. And then the doula came in and said, you need to leave. The doula hadn't even really heard the conversation. She just heard the mom. But I said, I'm not being rude. It just sounds rude because I'm talking like this. And so then, so I'm like, okay, I left, and I went to see if somebody else would see the patient. Now, I will tell you, the other person who the patient had been seeing, they decided they'd just let her dictate her care, which is totally appropriate. But I need to understand that you understand that your baby could die. And this is why we recommend this treatment. And so, and I don't mince words, because if I say, well, your baby might have something really bad happen to it, but you didn't understand it could die. And then you say later, well, you didn't tell me the baby could die. And so then, in all that, the patient decided to come back into the hospital, maybe because she heard the word or somebody said it to her directly. And I will tell you, I was given a lecture maybe 4 months later, that doula came up to me and apologized. She said, I didn't understand what was going on and what you're saying. I understand better now. So it's important that you work together with a doula or whoever you're working with, to be listened, to be heard, to have it wasn't, while everybody was trying to protect this patient,
Mm.
it wasn't necessarily in her best interest to say, well, do whatever you want to do and don't listen to the consequences. So I have high respect for doulas, and doulas are awesome in interacting with people, just like a nurse practitioner can be, or a mom who understands things, or somebody. You need somebody there, because when you're in labor or in pregnancy, you don't always hear everything. You don't always,
Right.
pay attention to everything. So you need somebody to help advocate for you.
Absolutely.
In either one of your opinions, what would you feel like would be the most urgent need, kind of going back to, this before we even get to the doctors, the healthcare system in general, that would have a significant reduce in maternal and infant mortality?
Well, I think as we have said, it's important for patients, individuals to understand the importance of health care, medical care, the difference that it can make. And if you've had what you feel wasn't the best experience, we'll just say, or if someone is perhaps giving you advice that you're not sure of, you need to talk to either your doctor, a different doctor, a trusted friend, someone who can help you to better understand it. Because I think you have to understand what can happen to you. So as Dr. Dungy-Poythress says, if you are told, well, your baby might not do well, it's very different from your baby could die. And this could happen, but there are things that we can do in the medical profession to help decrease that chance. And we've seen it work before. We know what we're doing and we want to help you. And I think it's important for patients to understand that all of us in medical care want to help. We want the best possible outcome for every patient. Yes, there are times when it feels like that's not the case, if someone's rude on the phone and all that. But ultimately, we take those oaths that say, we will help you do well, be well, and identify what your problem is and treat it. And we need to have that kind of trust from individuals so that then they'll come back to us or come to someone, even if they don't come back to us, that they recognize that we have lots of information. There's evidence-based science that says these are treatments that will address the problems, be it diabetes, hypertension, and pregnancy, and then that impact on children, i.e. the fetus and the newborn. If I know that this mom has one of those diagnoses, then I'm better prepared to manage that baby at time of birth. As soon as they're born, I want to then immediately start checking the blood sugar, checking their blood pressures, checking, the growth, monitoring what nutrition a baby needs to have. But I can start that at the very beginning. So if mom has received prenatal care and those issues have been identified, then we're prepared on our side to manage the babies better. I think just advocacy from the very beginning, before pregnancy, throughout, and then after.
Yeah, I agree. Don't wait until you're sick to find a doctor. Don't wait until you're pregnant to find an OB-GYN that you trust. And it can be hard and it can be challenging. And, they don't necessarily have to look like you. Studies and your personal relationship will tell you that people who understand where you're coming from and who resemble who you are, regardless of the color of your skin, resemble your background and your thoughts and your processes, you're probably going to relate to better. Find somebody you can relate to and trust, and do that work ahead of time before you get, high blood pressure or before you get pregnant.
Yes. Deja and I will ask you guys just a couple more questions before we get ready to turn to the audience for some questions as well. And so thinking back to the support, how do, fathers, come around mothers? I'll just leave it there. Let's go there.
Super important, right? And it's important for the father to feel included. It's important for that baby. I'm always going to speak about the baby to have that sense of interaction with the father, or the support. So it's the family, it's the community. And we want dads in the picture for sure. So if mom, we encourage breastfeeding with, newborns. So Mom breastfeeds, she pumps some, dad feeds that bottle to the baby. Any way that the dad can be included is important, starting out when the baby is a baby infant, and then as they grow up with that individual in their world, it's just supportive. We need that. As individuals, we're very social, right? And so we need that involvement from both parents or whoever is the significant other, the people who can then support those children as they grow. And, it's rare that I'll talk about anything without mentioning my daughters, and I have two, and they're in their 30s and they still call me and talk, and we talk, and I think that's important. And I think that we all need that from wherever we can get it. Moms, dads, aunts, uncles, godmothers, you name it. Neighbor.
Yeah.
Okay. Yeah.
I agree. And I think dads are sometimes overlooked, particularly, I will admit, in my field, we're so focused on the woman and her, whatever the problem is. And particularly, I deal with high-risk pregnancy. So there's usually something that's not quite right. And it's important to help educate the dad on that as well, who's at the appointment, or all the issues that dads have to take care of. Maybe you have other children and the dad is not there because he's taking care of other children and other issues. One of my favorite things used to be to say to a dad who sort of came in, do you need a cup of coffee? Would you like a cup of coffee? And they're like, it's all I have, but I'll offer you that. And they're so grateful oftentimes because, did you get enough to eat? Have you eaten? Have people paying attention to you because you're focused on the mom and trying to help take care of her. Sometimes it comes out a little angry. I'm trying to do this. I've got to be in control. I'm going to take control of this. So, my wife is not feeling well. What are you going to do? To realize that's not about me. That's not about me. And he's not angry at me. He doesn't understand the woman barely understands what it is. She's pregnant. The man is trying to understand oftentimes and totally not educated, not aware, not experienced in the things that women go through. And to understand there's a little anxiety there. There's a little bit, I'm scared. Maybe I had one patient, a husband, it wasn't even a husband, it was a boyfriend and a woman that I spent my lunch hour, over the hour, going back and forth talking to them because I was recommending they deliver a little bit early. And he didn't want to. And he kept wanting to ask me questions. So you guys think it through. Here's what we recommend. And finally, he said, well, what if my baby dies? I said, I've never seen anybody die at 36 weeks from being delivered prematurely. And he yelled back at me, but I have. That was the issue. And it took us an hour to get to that. And whatever this baby died of, he said the doctors told him it's because it was premature. I don't think that was the case. But that was the issue. And I said to him in a nice way, yeah, it took us a long way to get here. I need you to tell your doctors what you're afraid of. And sometimes that's a little hard for men to do. But if we can understand and have a dialogue, here's what I'm really concerned about. Here's what I'm scared about for my wife or whatever. And sometimes that comes out a little bit harsh and a little bit angry, but to understand that's not about me and that's not about you being a bad person. It's just we're both concerned about this woman right here and how do we work together to help this woman.
Absolutely. So going off of that, sorry, what steps can be taken to improve postpartum care and mental health support for moms? And
mental health, so important before, during, and after pregnancy, but particularly after. I don't know if you have children, but anybody who's had a baby knows it's rough. It's hard on a good day, let alone having some complication that you're in the hospital for 3 months afterwards, or that you're still in the hospital, or that your baby's in the hospital. It's challenging. And the mental health concerns with just everything going on in our society today, and you're worried about things, and if you have other children on top of that, or elderly parents that you have to take care of, all the intersectionality that a woman let alone a man, but that a woman has to go through of all the things she might be concerned about. Mental health is important, and to have culturally sensitive mental health care is important, and we don't have enough mental health care. That's something we need to work on. The providers, you can recognize and say, now what I do, I'm not trained enough in it to really help people. Sorry for hitting my mic, but you know, I recognize this need. I now want to refer you to somebody. I will tell you something I learned. I was given a lecture yesterday, and this woman said to me, this care provider who's a nurse practitioner, which I thought was brilliant, and I haven't thought of it before, but I'm telling everybody about it now. So back at 20 weeks or 22 weeks or whatever, when she recognizes a patient has hypertension, she knows that patient's going to need some primary care after delivery. She puts the consult in then, because she knows it takes a long time to get a primary care visit and schedule. She said, even then, I can't get some patients in to see a doctor postpartum when I deliver them. And so I thought that was brilliant. We don't have enough doctors in the mental health field, or doctors or psychologists or other providers, but it's so key in so many things with everything that's going on in our society. We have spiritual hesitancy. We have cultural hesitancy about the fact that I would like to have some help with my mental health. I love the commercials. I love that commercial with the guy with the weights, and he's lifting. He's like, "You need some help, man?" He's like, "No, I'm good. I'm good. I'm good." "You sure you don't need some help, man?" And like, "Yeah, I need a little help." And there's people out there to help you.
Yeah, the acknowledgement by the individual that they need help is important. Shouldn't be shame. You know, it shouldn't be, I don't want to ask because I don't think it's something wrong with me. I dare say everyone in this room has had a moment
Amen.
when they could have used
Amen.
someone to talk to about a situation, you know, and oftentimes in the middle of the night, or, you know, it's a time when no one else is around. And so get on your knees, right? But then there are these services that we need to accept and acknowledge. And as you describe, postpartum depression, however you want to describe it, it's hard. And then if your baby doesn't go home with you, because when you get pregnant, you're gonna have a baby, you would start envisioning, right? That perfect day, 9 months out, you're gonna take this baby home in peekaboo or whatever. And then something happens, the baby goes to the NICU, and that means your baby's not in the room with you, you're not able to do all those things that you had planned. And now your baby's going to stay, and the hospital says, you have to be discharged, Mom. You can't stay any longer. But my baby is here. Sorry, you know, you're going to have to be discharged. So it's a very difficult time at best with everything going right. And then if a baby has issues that requires additional care, couple days, months, longer sometimes, that's hard. And so the mental health needs are tremendous for every mom who has delivered a baby. And then, as I say, for most of us, at some point, we could use someone to talk to.
Yes. No, yes. Not to completely summarize, because we'll still have some more questions and some more thoughts around things. But a lot of what you guys shared, you know, I came to grips of just taking the time to take the time with folks, you know, be there for individuals, you know, hear them out. You know, just like the story of the father, you know, it was the relationship that continued on before he, you know, had this space of sharing what was actually wrong, you know, or any of these mothers, you know, being advocated for is just this relationship piece. So I think that's huge. So anyone in person, feel free now to kind of chime in, ask a question, and any of those online, please drop them in the chat as well.
So, you know, we all know how important, you know, resources and, you know, accessibility are to prenatal care. However, we're also aware that there's a lot of barriers to accessing that important care. In your opinion, what are some ways that maybe the different sectors in the community can work together to address that accessibility barrier and allow mothers and expecting mothers, and then also the people working with them, to get them to the appropriate resources that they may need?
Well, I always say that knowledge is power. So to share the knowledge, to share why it's important, to share with, and there are resources out there in the community. And I always say it's hard to beat a good team. So if we work together, you know, I work at Riley. Dr. Matory works at Riley and Eskenazi. Riley's an awesome system, but we can't expect everybody to come to Riley. We have to work with our partners out in the community who already have the relationships, who already have the trust with the community, and build those resources and work with those other resources and connect them with each other so that we can provide those resources, I think is a way to do it, and to educate the community on what's available. Did you know this is available over on this side of town? Or did you know this is available, maybe in your own community? Or did you know it's important to find a doctor now and go in and be seen? And if you don't like this doctor, ask around to some other programs or stuff that's in the community that might help you find somebody that better suits your needs.
Yeah, I would tag to that also, spreading the word, and I think that's what you're saying. So if you in your circle of friends have had a good experience and you know someone, and then you happen to be at church or at a party or wherever, and there's someone who is saying, I don't have a doctor, but I don't trust doctors because I don't trust doctors, and I'll be okay. This is my third baby. I've had two and they're all fine, so I don't have to go to the doctor. Trying to educate that individual that every pregnancy is different, number one. And even if you haven't had a good experience in one spot, for example, Eskenazi, we have lots of clinics, Riley, lots of clinics. All of the hospitals have clinics and setups in the community. Reach out. And once again, and I said this earlier, we all want it to go well for you. We all in our profession want you to do well. We want healthy babies. We want healthy moms for the long haul. Because yes, it's maybe 7 or 9 months at this point during the pregnancy, but so much of what a mom experiences when she's pregnant is going to impact her after, right? And if she's not healthy as a new mom, she can't then be there for her children. And, it just spins out of control. And so anything that can help to spread the word in terms of education, availability of resources, they may not be readily accessible at this point, but what can we do? And I think the discussions like this that include individuals in all of aspects, whether it's nursing, community health worker, physician, provider, doula, to then just brainstorm, okay, what can we do? How can we improve the care and the provision of care and resources for patients and people in our communities? We have to do this.
Or maybe it's even like, at this church over here, they have mental health service, or they have a person who will talk to you. Or, a lot of people in I had problems with not feeling so great after delivery, and I had a little bit of postpartum depression, and I talked to this person at this church, or they have diapers over at this church for services, things that help relieve some of the anxieties and challenges that you have. It doesn't even necessarily have to be directly related to medicine, but the more we can help and release some of the stresses, can help people take a little anxiety off of them.
There was someone with a question in the back. Oh, okay.
I do have one online, okay, jumping in then. It's a long question. I'm going to summarize it. Basically, they're asking, what advice can you give to someone who doesn't know how to advocate for themselves or doesn't have people around them to help them advocate for themselves in the doctor's office?
I would say in the doctor's office, or particularly when you're in labor and delivery. You're in labor. That's a very vulnerable position. And you want to say, hey, I don't think you're treating me right. And you're totally at the mercy of the people who are taking care of you. So I would say things that you can do is attend programs like this. Know things like what preeclampsia, what the symptoms are or something. So you can say, hey, I think I might be a preeclamptic. You might even say, I heard that Black women die more from this. And I'm Black, so I'm a little bit afraid of this. And so now it's caught their attention. But it can be challenging. It can be challenging. You can be like Serena Williams with all the money and be educated and say, I don't think you're treating me well. I think I need this and that. And your doctor or provider might become a little offended. You don't have the resources like she did to get on the phone to her agent and say, get me out of this hospital. You're totally at their mercy. I tell people, if you don't feel like you have anybody else, or you don't feel like it's wise for you to be your own advocate, call pastoral care. it's hard for physicians and providers to and tell that pastoral care person, I don't feel like they're listening to me, or I'm scared about something. I'm scared I don't feel right. I don't know what to do. Can you help me get some resources, or can you help them listen to me a little better?
And don't be afraid to ask questions. Don't feel that you're supposed to know the answers and the doctor knows everything. No, ask the question, ask the patient. And if physician, the provider says something you don't understand, say it. I don't understand. Please help me to understand this. And know that you're not alone in that. Patients all the time feel intimidated and think, well, I'm supposed to know. If I don't know, it means that I'm not smart. No, you are not going to know a lot of this information. It's not something that you just read about in a book. And so if you have concerns, you don't feel right, if they are seemingly ignoring your concerns, ask for someone else as pastoral. If you don't have someone else to advocate for you, ask the question, why do I feel like this? And you should get the answer. You shouldn't get, well, that's just the way it is. No, what's causing this? And why isn't it going away? And what's going to make it go away? Don't feel intimidated if you're going in as a patient. If you're a patient, ask questions. You really have to do that so you can advocate for yourself. And we have to learn how to do that. It's not easy. We learn it, we teach our children. They watch us, we're the role model. And so they will remember when I was at the doctor, and I had a rash on my leg, my mom asked, where did it come from? What caused this? And so then that child hopefully is hearing that and will then think to do the same thing when they're having to speak for themselves. But ask the questions.
But it also speaks to being comfortable with your doctor and finding a doctor you trust before you get into a critical situation. And even if they're not the doctor on call, for example, when you're in labor, but you have a good relationship with them, you could call them and say, I'd like to just speak to Dr. So-and-so. He or she is my usual doctor, and tell them I just don't feel like they're listening to me, or I don't feel comfortable. But I can't stress enough that I think it's important to find a doctor for routine annual visits before you get sick or before you become pregnant. Question way in the back there.
It's being like a worldwide issue. Where do you begin to start to combat it, on a global scale, because some communities are pouring them up.
I say start where you are on the way to where you're going. So start with what you can do. What I can do right here, right now, is vote for the people I want to represent me, who will pay attention to my issues that can be addressed better. So that's one place you can attend programs like this, help out in your church, help out in volunteer for things, educate your daughters, your sons, people on things like that, gain more information. But there's, you start where you are. And one of the things I can't emphasize enough, even though it may seem like it matters little, it matters a lot to have people who represent you on government levels so that they can address the needs that you have. So one of the very first things you can do is vote for people who, and make them accountable to you, go and write your congressman or whatever, see your local board school, the school boards. There's so many places to advocate and be represented that we need to keep attention to that.
And so find out what those individuals stand for, and it's not the week before the election that then you try to get to know, what they represent. Start now, voting is important and crucial to make change.
I have a follow-up to that, actually. So could you touch on how does policy impact maternal and infant health? And how can people get involved in helping with potential policy reform?
So certainly, you know, if we look at policies, if we look at perhaps some of the initiatives are just that are coming out, and we don't know where we're going with that. But if we look at the things about maybe we need to cut Medicaid, maybe we need to not expand Medicaid for a year after delivery for people. Maybe we need to look at resources that are covered by different insurances, et cetera. Those things are important. How do we get involved with? Understand what those issues are, as Dr. Matory said, to understand who thinks like you do, or who's paying attention to things, interact with them. And it may be just on some local level in your church. Let's create a group that's looking at what's important for maternal health care in our neighborhood. Do we have access to clinics around here? Are those clinics friendly? Are they, do they treat us well? Do we want to then make whoever's in charge of that know more about things? Start where you are on the way to where you're going. That can build. I think there's lots of different avenues, and you can say, I'll never impact government policy. Well, I think we're seeing that sometimes people can come together when it affects them enough, then maybe policies will change. But if you don't say anything and you don't advocate for yourself and for your family, there's no hope of it. And so there's probably more than one answer to that, and you decide what you can do. We can all pray, amen. And so we definitely need to pray about all that, and then lead, let the Lord lead us what we can do.
I think you had one question, did you?
Yes, so I just had a question. So there's people that, do want the help, but sometimes there's other barriers. So how do you give quality care to individuals who maybe have a language barrier or don't have like good insurance or any insurance? How do you guys go about that?
Yeah. Well, the hope, of course, is that across the board it's equal. In most programs, clinics, offices, and the like now, there is recognition of a diverse set of languages. And so either languages through an interpretation, so having interpreters, there's online interpreter availability, the paperwork, the brochures, whatever, should be in multiple languages. And we work really hard to then meet the needs of the community and the individuals that we serve. Recognizing that if someone doesn't understand, whenever I think about it, I hear some of the situations, I envision if I was in any other country where the primary language is not English, how I would feel if I then became ill and what I would need to hear and the support I would need. And so I try to put myself in the shoes of those individuals who are coming to us who speak other languages. And so having interpreters, having someone who is sensitive to their needs and their understanding, their perspectives, it's crucial. And trying to hire, even in your clinic and wherever we're working, individuals who can help to relate. Even if it's a volunteer who comes in once or twice a week, who then can relate to individuals, various languages, Haitian, Creole now, Spanish, our Swahili, whatever it is, to have someone who can help those individuals feel comfortable and then receive the care that they need.
And even with those smartphones these days, it takes a while, but you can figure out to say a few words back and forth. The other thing I will say, currently in our system, if you are pregnant, you are eligible for Medicaid if you have no other insurance. And so don't let the fact that you have no insurance keep you from going in to get medical care. People may not educate you on that availability, but that right now is currently the standard.
Do we have any other questions online?
This one, I'm going to read it. I don't know if it pertains exactly, so you guys decide. Have you seen success with infant CPR, and does choking training? When have you seen the most successful places and people or new parents to get that training?
Okay. Well, certainly we would advocate for knowing what to do if your child's choking. And there are classes at hospitals. Some clinics might provide that education. you want to make certain that it's a reputable setting. And so someone who's certified to provide CPR for infants, and you get that training, appropriately. When we discharge babies from the hospital, we talk about some very basic kinds of things, what to do, how to have safe sleep, what to do, how to feed, what to feed, to hopefully avoid choking situations. But certainly getting that education is helpful, it's important work.
Knowledge is power.
Well, as we wrap up our time, I always try to end any segment just with one-liners for the community. We've heard a lot of information, and, not to try to compile it all into one thought, but what would be your one send-off? Let's say someone just hopped online right now and they're listening in. So just one-liner for the community.
My thought would be spread the word. And I would ask that you think about the pebble that you throw into the water, and you know how the ripples go out. Spreading the word about the importance of prenatal care, and then being willing to advocate for yourself, ask questions for your health, and, take care of you, take care of your family.
And mine would be the better you are, the better you are, the better you are before pregnancy. So find a doctor. I cannot stress enough. Do not wait till you're sick. Do not wait till you have the signs and symptoms of hypertension that anybody could recognize. You can't tell you have high blood pressure or a lot of medical problems till you see a doctor. Find a doctor that you appreciate, that you respect, that respects you, that you trust. And it might be, hairdressers, or you go to a couple of them before you find the one you really want to stick with. Keep pursuing to find the best care that you can, and find a doctor, see them on a regular basis, get in the best health you can before you even consider pregnancy.
Awesome. Well, we want to thank both you, Dr. Dungy-Poythress and Dr. Matory, for joining us for this critical conversation. We want to say peace out to our online audience. Those of you in the room will still be around for further questions. Thank you so much.